Hello, everyone. I am Dr. Tracy Bennett. Today, I want to speak directly to anyone who is living with diabetes or caring for someone who is. Managing blood sugar can feel overwhelming. There are medications, diet plans, conflicting advice, and constant numbers to track. But what if I told you that nature may already hold part of the answer? In the last decade, science has started to catch up with what traditional medicine has known for centuries. Some herbs, simple, natural, and readily available, are showing real promise in helping the body manage blood sugar more effectively. They are not replacements for medical care, but they can be powerful partners in your journey to balance and strength. Today, I am going to share two of the most researched and respected herbs when it comes to supporting healthy blood sugar levels. You may have heard of them before, but after today, you will understand how they work, what science says about them, and how to use them safely and effectively. This is not a trend. This is about reclaiming your health, one natural step at a time. So let us begin. Part 1. Clove. The tiny spice with powerful potential. Let me introduce you to a spice that has been used for thousands of years, not just in cooking, but in healing. Clove. You might know clove for its rich aroma or as something you use around the holidays. But what you may not realize is that this small, dried flower bud holds powerful compounds that can support your body in managing blood sugar. Clove contains a natural compound called eugenol. Eugenol is known for its anti-inflammatory and antioxidant properties. But recent research is uncovering something even more exciting. Eugenol may actually improve the way your body uses insulin. Let me explain. Insulin is like a key that unlocks your cells, allowing sugar from your bloodstream to enter and be used as energy. But when your body becomes less sensitive to insulin, a condition called insulin resistance, sugar stays in the blood, leading to higher glucose levels and more stress on your organs. This is where clove can help. In several animal studies, extracts from clove were shown to increase insulin sensitivity. That means the body responded better to insulin, blood sugar levels dropped more quickly, and glucose moved into the cells more efficiently. These are the exact outcomes we want when managing diabetes. But it doesn't stop there. Clove is also a powerful anti-inflammatory. And if you are living with type 2 diabetes, you already know that chronic inflammation can make everything worse, from fatigue to nerve pain to complications in the eyes, kidneys, and feet. Reducing inflammation is one of the most important things you can do to protect your body long-term. And clove can play a role in that. Now let's talk about how to use it. Clove can be added to food as a spice, brewed into tea, or taken as a supplement. But dosage matters. Most of the research uses standardized extracts in controlled amounts. If you are considering using clove therapeutically, speak with your healthcare provider, especially if you are on blood thinners or diabetes medications, as clove can enhance their effects. A safe way to begin is by incorporating small amounts into your cooking. A pinch of ground clove in oatmeal, tea, or stews not only adds flavor, but begins to introduce the body to its healing properties. You can also try clove tea. Just steep 1 or 2 whole cloves in hot water for 5 to 7 minutes. It is warming, slightly sweet, and very soothing. What I love most about clove is that it represents the best of both worlds. It is simple and natural, yet backed by real science. It does not require a prescription. It does not come with a long list of side effects. And for many people, it is already sitting in the spice rack, just waiting to be used with intention. Clove is not a cure, but it is a helper, a small tool with big potential. And when you start adding up these small tools, a better meal here, a calming tea there, you start creating a stronger, more stable foundation for your health. In the next part, we are going to look at another ancient remedy that is making headlines in modern science, a golden root that holds remarkable promise for people managing diabetes. Part 2. Turmeric, the golden spice that calms the storm inside. If there is one spice that has earned its place in both ancient healing and modern medicine, it is turmeric. This vibrant yellow root has been used in traditional Ayurvedic and Chinese medicine for centuries. But now, science is confirming what many cultures have known for a long time. Turmeric is a powerful ally in the fight against diabetes. The secret lies in a compound called curcumin. Curcumin is the active ingredient in turmeric. It is a natural anti-inflammatory and antioxidant that has been widely studied for its effects on the body. But its most impressive work happens in the way it supports insulin function and reduces the stress diabetes places on the body. Let's break it down. When your body is dealing with high blood sugar, it also has to manage the damage that sugar causes in the bloodstream. This damage is known as oxidative stress. It inflames blood vessels, harms nerves, and puts pressure on organs like the kidneys and eyes. Over time, this leads to the complications many people fear: vision loss, kidney decline, numbness, and more. Curcumin helps protect the body from that damage. In multiple studies, curcumin has been shown to reduce blood glucose levels and improve HbA1c, the long-term measure of average blood sugar. It also helps reduce insulin resistance, which means your body can respond more effectively to the insulin it already produces. But turmeric does more than manage numbers. It supports the entire system. Curcumin improves liver health, which is essential for processing sugar. It supports the pancreas, which is responsible for producing insulin. It even protects the heart by lowering inflammation and reducing plaque buildup in arteries. This is vital because people with diabetes are at a higher risk of cardiovascular disease. And here is something even more encouraging. In one clinical study, participants with prediabetes took curcumin supplements over 9 months. At the end of the study, none of them progressed to full-blown diabetes. In contrast, a significant percentage of people in the placebo group did. That tells us something powerful. Turmeric is not just for managing diabetes. It may help prevent it. Now let's talk about how to use it. Turmeric can be taken in food as a tea or in supplement form, but there is a trick to making it effective. Curcumin is not easily absorbed by the body on its own. That is why it is often combined with black pepper extract or piperine, which increases its absorption by up to 2,000%. If you are cooking with turmeric, try adding black pepper and a small amount of healthy fat like olive oil or coconut oil. That way, you enhance absorption while making a delicious, nourishing meal. Turmeric can be added to soups, stir-fries, eggs, rice, or smoothies. You can also try golden milk, a warm drink made with turmeric, almond milk, cinnamon, and a pinch of black pepper. It is both calming and healing. If you choose a supplement, look for one that includes piperine or is labeled for high bioavailability. And as always, check with your doctor first, especially if you are taking medications, since curcumin may interact with blood thinners or diabetes drugs. I often tell my patients this. Turmeric is not magic, but it is wise. It works slowly, consistently, and gently, like a river shaping stone. And when used daily, it can bring powerful, lasting change to how you feel, how you heal, and how you live. In the next section, we will look at how these two herbs, clove and turmeric, compare to standard treatments and how they might work alongside your current care, not in place of it. Part 3, Herbs and Medicine, working together, not against each other. Now that we have explored the healing properties of clove and turmeric, you might be wondering something important. How do these herbs compare to traditional diabetes medications? And is it safe to use them at the same time? These are excellent questions. And I want to be very clear. Natural remedies like clove and turmeric are not meant to replace your medication, but they can support your treatment. When used correctly, they may help your body respond better to insulin, reduce inflammation, and possibly allow you to manage your condition with fewer side effects or complications. Let's look at how they compare. Conventional medications for diabetes are designed to lower blood sugar. Some increase insulin production, others slow carbohydrate absorption, and some improve insulin sensitivity. These medications are often necessary, but they can come with side effects, things like nausea, fatigue, weight gain, or even risk of low blood sugar if not monitored closely. Over time, some patients find that their medication needs increase or become harder to balance. This is where herbs like clove and turmeric can play a gentle but important role. Studies suggest that clove improves insulin sensitivity, something that certain medications like metformin also aim to do. But clove does this naturally, and without the risk of digestive upset or blood sugar crashes. When combined with healthy eating, it can help stabilize glucose levels throughout the day. Turmeric, on the other hand, targets inflammation and oxidative stress, two things that medications do not always address directly, and yet they are major contributors to diabetic complications like nerve damage, eye disease, and heart problems. By reducing inflammation, turmeric supports long-term healing that medication alone cannot always provide. Now let's be clear. If you are already taking prescribed medication for diabetes, you should never stop or adjust it without your doctor's guidance. However, bringing in natural supports like turmeric or clove may allow your doctor to fine-tune your treatment over time, possibly reducing your dosage or preventing the need for more aggressive interventions later on. It's also worth mentioning that both herbs may help with some of the side effects of diabetes. For example, turmeric's antioxidant properties can improve joint pain, which many people with diabetes experience due to inflammation or weight-related strain. Clove may help with digestive discomfort and improve circulation, both of which are common issues in this population. The key is integration, not isolation. Use what works from modern medicine, but bring in the wisdom of natural remedies too. Let your care plan be as balanced and whole as you are. If you are considering adding clove or turmeric to your routine, start small. Keep a log of how you feel. Track your blood sugar closely. Let your provider know what you are doing. When your care team is informed, they can guide you more effectively and help you avoid any potential interactions. This approach, combining the best of both worlds, is what real wellness looks like. It is patient-centered, it is personalized, and it is built around your body, your needs, and your goals. In the next part, I will share real-life stories from individuals who began using these herbs alongside their treatment plans and the surprising changes they experienced. Part 4. Real Lives, Real Results, Stories from the Journey. One of the most powerful parts of my work is hearing from patients who have found relief, strength, and transformation through small but meaningful changes. Today, I want to share a few stories from individuals who began using clove and turmeric as part of their diabetes journey. These are not miracle cures. They are real people with real results, built on consistency, curiosity, and hope. Let me begin with James. James is 62 years old. He has been managing type 2 diabetes for over a decade. He came to me after feeling frustrated with his medications. His blood sugar was still unstable. His joints ached. He felt exhausted most afternoons. Together, we looked at his diet, movement, stress, and supplements. We started by adding turmeric tea every evening. He mixed a teaspoon of turmeric with warm almond milk, cinnamon, and a small pinch of black pepper. After 2 weeks, he reported sleeping better. His knees felt less stiff. and after 6 weeks, his morning blood sugar dropped by 15 points. His doctor noticed the change and helped him slightly adjust his medication. He felt hopeful for the first time in years. Now let me tell you about Amina. Amina is 58, and she was recently diagnosed with prediabetes. She wanted to avoid medication if possible, so she started learning everything she could about natural options. She read about clove and decided to try clove tea, just 1 or 2 buds steeped in hot water daily. After a month, she said something interesting. "My cravings have changed," she told me. "I do not reach for sweets the way I used to. I feel more steady." Her lab results supported what she felt. Her fasting blood sugar improved, and more importantly, she felt empowered. She had found something simple, affordable, and effective. Then there's Henry. Henry is 70. He had been taking medication for diabetes for 15 years and was also dealing with high blood pressure. After watching a segment about anti-inflammatory herbs, he asked his doctor about turmeric. With approval, he started taking a curcumin supplement once a day, along with his usual medications. Within 3 months, his inflammation markers dropped, his energy returned, his digestion improved, and for the first time in a long time, he began walking every evening again, something he had stopped doing because of leg discomfort. These stories are not unusual. In fact, I hear them often. The common thread is not just turmeric or clove. It is that these individuals decided to participate actively in their healing. They asked questions, they stayed curious, and they kept going, one step at a time. I want to remind you, your story can change too. You may not see results overnight. That's okay. Healing is rarely instant, but when you give your body tools like anti-inflammatory herbs, nourishing food, rest, and movement, you create the conditions where healing can begin. In the next part, we will dive into how to safely add these herbs to your daily life, including dosage, timing, and what to watch out for to get the best results without risk. Part 5. How to use clove and turmeric safely in daily life. Now that we understand the science behind clove and turmeric and have heard how real people are using them, the next question is simple. How can you bring these herbs into your life in a way that is both safe and effective? Let's begin with clove. Clove can be used in several forms, whole, ground, or as an extract. The easiest way to start is with clove tea. Just take 1 or 2 whole cloves, place them in a cup of hot water, and let them steep for 5 to 7 minutes. The flavor is warm, slightly sweet, and calming. You can drink this once a day, preferably after a meal. If you prefer using ground clove, you can sprinkle a small amount, no more than 1/8 of a teaspoon, into oatmeal, soups, or teas. It is very strong, so a little goes a long way. There are also clove supplements available, but if you choose to go that route, speak with your doctor first. Clove extract is powerful, and when concentrated, it can affect blood clotting and interact with certain medications, especially blood thinners and diabetes medications. Now let's talk about turmeric. If you are cooking with turmeric powder, start with 1/4 to 1/2 a teaspoon per day. Add it to scrambled eggs, soups, curries, or roasted vegetables. Remember to combine it with a small amount of black pepper and a healthy fat like olive oil. This helps your body absorb the curcumin, the active healing compound. If you enjoy warm drinks, turmeric golden milk is a wonderful option. Mix a 1/2 teaspoon of turmeric with warm almond or coconut milk, a pinch of black pepper, cinnamon, and a little honey if desired. Drink this in the evening to calm the body and support overnight repair. For those who want more concentrated benefits, turmeric supplements are widely available. Look for one that contains black pepper extract or piperine, which boosts absorption significantly. A typical safe dosage for curcumin extract is around 500 to 1,000 milligrams per day, depending on your individual needs. As always, speak with your healthcare provider before starting a new supplement. This is especially important if you are already on medication for blood sugar, cholesterol, or blood pressure. While turmeric and clove are natural, they are also potent and can enhance the effects of certain drugs. What about timing? Both clove and turmeric can be taken any time of day, but many people find that taking turmeric with meals, especially dinner, helps with digestion and relaxation. Clove tea can be enjoyed after lunch or in the evening. Try to be consistent. Herbs work best when used regularly and gently over time. One more important tip: start slow. Your body needs time to adjust to new substances. Begin with small amounts and increase gradually if needed. Track how you feel. If you notice better energy, improved digestion, or more stable blood sugar, you are likely on the right path. And finally, quality matters. Choose organic spices when possible. Avoid products with fillers or additives. A good herb should have a strong smell, vibrant color, and a clean ingredient label. You're putting this into your body, so make sure it is something your body can truly benefit from. In the final section, I will leave you with encouragement, a summary of what we've learned, and some loving reminders about how small, natural steps can lead to big, beautiful changes in your health. We have come a long way together. We explored the science behind clove and turmeric. We talked about inflammation, insulin resistance, and the power of natural healing. We heard stories from real people, and we looked at how to use these herbs safely and effectively in your daily life. So what does this all mean for you? It means you have more tools than you may have realized. Your healing is not limited to prescriptions and lab results. Nature offers gentle support, not to replace your current care, but to walk beside it, to strengthen it, to help your body do what it was designed to do: heal, adapt, and thrive. Clove and turmeric are not magic, but they are meaningful. They are consistent. They are deeply rooted in both history and modern science, and they are accessible. Whether as a warm cup of tea, a splash of spice in your dinner, or a thoughtfully chosen supplement. You do not need to make every change all at once. You just need to begin. Start small, stay curious, talk with your care team, listen to your body, and remember that every positive choice, no matter how small, builds a stronger foundation for the days ahead. If you found this video helpful, please click the like button and let me know in the comments which herb surprised you the most. And don't forget to subscribe and turn on notifications so you never miss a video that could change your health for the better. Stay informed, stay gentle with yourself, and stay hopeful, because your best health is still possible. I will see you in the next video.